Assalamu alaikum rahmatullah. The next segment takes us to the Masroor Eye Institute and to discuss the construction and the project itself. I'm now joined by Sadr Majlis Ansarullah on my right-hand side, Dr. Imran Masood Sahib, who's on my left-hand side, and also Mia Wakas Sahib. Before we talk to our guests, let's take a look at the project itself and how it was described and presented in front of Hazur Aqdas.
At the end, Sadr Sahib delivered a presentation on the Masroor Eye Institute.
حضور اقدس سید اللہ تعالیٰ بن نسل عزیز نے ازراہ شفقت 2016 میں مجلس انصاراللہ یوکے کو مسرور آئی انسٹیٹیوٹ بنانے اور چلانے کی ذمہ داری برکینا فاسو میں عطا فرمائی تھی. 2017 میں حضور اقدس نے ایک اینٹ پہ دعا کر کے خاکسار کو دی، جو کہ خاکسار کو سعادت نصیب ہوئی برکینا فاسو جا کے اس کی بنیاد رکھنے کی. عمارت کی تعمیر کا کام 2017 میں شروع ہو گیا. حضور اقدس بلڈنگ جو ہے وہ تعمیر کے مراحل سے گزرتی ہوئی اس وقت تقریباً مکمل ہو چکی ہے. بلڈنگ اندر سے مکمل ہے. اب اس وقت بلڈنگ کے باہر کا کام جو ہے وہ جاری ہے، جو کہ انشاءاللہ اگلے تقریباً 1 ماہ کے دوران مکمل ہو جائے گا. یہ عمارت کا حصہ جو ہے یہ بوستان مہدی، جو کہ واگاڈو برکینا فاسو کا کیپٹل ہے، وہاں سے گانا جانے والی مین سڑک پر واقع ہے. تقریباً 4.5 ایکڑ کا یہ پلاٹ ہے اور یہ 2 منزلہ عمارت ہے. اس 2 منزلہ عمارت کے اندر 2 آپریشن تھیٹر موجود ہیں، جس کے علاوہ 6 کنسلٹیشن رومز موجود ہیں. اور اللہ تعالیٰ کے فضل سے وقت کے ساتھ یہاں پیچھے جو حصہ نظر آ رہا ہے اس میں 2 گھر بھی بنائے جائیں گے. پیچھے جو ایک عمارت کا حصہ نظر آ رہا ہے اس وقت وہ سیپریٹ سٹور ہیں اور جو واشنگ فیسلٹیز ہیں اور کچن کی فیسلٹیز وہ اس آؤٹ بلڈنگ کے اندر موجود ہوں گی. آج کل سامنے اندر کا حصہ اس وقت کمپلیٹ ہے. یہ کچھ تصاویر جو حضور دیکھ رہے ہیں یہ جس وقت سیلنگ اور چیزیں انسٹال ہو رہی تھیں اس وقت کی ہیں. اندر کے مناظر اس سے آگے ابھی دکھائی دیں گے، جس میں مین لابی اور مین گیلری شامل ہے. یہ تقریباً اپریل کے مہینے کی فوٹوگرافس ہیں اس وقت. یہ اندر کی کچھ تصاویر حضور دیکھ سکتے ہیں لابی کی. اسی طرح جو سامنے اب سڑک ہے اور سامنے اس کے اوپر پیونگ کا کام اور جو باغیچے کا حصہ ہے اس کے اندر مانسون کی بارشیں شروع ہو گئی ہیں تو اب گھاس لگانے کا کام جاری ہے. تو انشاءاللہ یہ اگلے 1 ماہ تک مکمل ہو جائے گا. حضور اقدس کی خدمت میں عاجزانہ درخواست ہے کہ دعا فرمائیں کہ اللہ تعالیٰ مجلس انصاراللہ یوکے کو آسن رنگ میں یہ ذمہ داری نبھانے کی توفیق عطا فرمائے حضور اقدس کے ارشادات کے مطابق. جزاک اللہ حضور.
جزاک اللہ. ماشاء اللہ بڑا اچھا بنا لیا ہے. اس کو چلانے کی بھی توفیق اللہ تعالیٰ دے آپ لوگوں کو.
آمین.
اللہ حافظ. السلام علیکم ورحمۃ اللہ وبرکاتہ.
السلام علیکم ورحمۃ اللہ وبرکاتہ.
السلام علیکم.
So we've just seen some wonderful footage and pictures of the Masroor Eye Institute. Can you tell us a bit more about the instructions and the guidance that Hazur has kindly given to Majlis Ansarullah, and why was Burkina Faso selected as the country for the Eye Institute?
Historically, Majlis Ansarullah, through Charity Walk for Peace, has been the biggest donor to humanity first. And in the years 2013, 14, large amounts of sums were being paid to carry out cataract operations in West Africa. And then in 2015, on the 75th anniversary of Majlis Ansarullah, the then Sadr Majlis in the Amla decided that they wanted to give a Sadqa Jariya gift on behalf of Majlis Ansarullah as a thanksgiving to Allah the Almighty. And it was promised that £500,000 will be raised and donated to make an eye facility anywhere in the world wherever Hazur Aqdas would desire. And then Hazur Aqdas very graciously selected Burkina Faso. Lots of operations previously had been carried out in Burkina Faso. As Dr. Saab would be able to tell you later on as well, this part of Africa, the sub-Saharan desert, the eye diseases are rampant and cataract is extremely common and eye facilities are very, very rudimentary.
And what are the kind of challenges that you've had to face in the construction and implementation of this project?
I think most of all it is the technical ability of the people on the ground. So first, initially it was thought that we could hand it over to a company on a turnkey basis, and the cost of that would have been more than £1,000 per square meter possibly of the completed hospital. So then it was a hybrid model. We supervised it ourselves with the help of IEEE Pakistan. We requested Hazur Aqdas Sayyidullah Ta'ala bin Aziz to get us an overseer from there. So that overseer was provided, and then supervision from the UK, including Chaudhry Wasim Saab, who I would certainly like to mention. He has spent significant period of time supervising there, months and months at a time, particularly during the COVID period.
It looks like an amazing project, the building itself. The outlay looks like it's practically in the west. Tell us a little bit more about the facility itself.
So the facility, as I said, initially when we had promised £500,000, the plan was to make an eye clinic. And then when Hazur Aqdas very graciously allowed us to name it as Masroor Eye Institute, at that time he smilingly remarked that, you're naming it after me, iski laaj bhi rakhna. And at that time we promised that whatever amount would be required, we would fund it. It was upgraded to be an institute, and institute not only in name. So the concept which is there, and I'm sure the medical director would be explaining it much more, is to collaborate with the local people there, the local medical university, professors, trained doctors, trained paramedics, and have an international faculty and a local faculty. And this, Hazur Aqdas, in 2019, a minister visited for our Jalsa Salana, and he met Hazur Aqdas. And Hazur Aqdas very graciously said to him, this would be the best facility, not only in Burkina Faso, but the whole of West Africa. Inshallah.
Dr. Saab, you're an ophthalmic surgeon yourself, and I understand that this institute will also be a training institute. How do you expect to manage that, implement that? Tell us a little bit more about it becoming a training institute.
So training really has two aspects to it. Number one is, how do we train the local surgeons who are already, if you like, they're experts, but are in need of enhanced skilling up. The way we're planning on doing that is, at the moment we've started off by doing some Zoom work with them over online during the pandemic period. So I've personally been in touch with some of the doctors over there, and we've run some online webinars to give them some early education. In the longer term, the international faculty will take in rotation, will go out there and will train the local doctors hands-on. So that's one aspect of it, is training the doctors who are already there, upskilling them to bring their level of their skills up to what we aspire to in the Western world. The second aspect of the training is the training of the local junior doctors. So what we're hoping is, because it's the Masroor Eye Institute, it will be a training institution, it will be a teaching hospital that will be part of the training rotation for the junior doctors. So the junior doctors will rotate through that hospital and be trained in the various aspects of eye care as part of their formative training. So those are two ways in which we hope that we will be able to train the future generations of doctors in Burkina Faso. And long term, what we hope is this will become a self-sustaining development, in that doctors from other parts of West Africa will come there as well to gain advanced training. So that's the long-term vision, inshallah.
That's quite important, I understand, from the history of charities. Many charities go to Africa and they set up nice institutions, but after some time, those same institutions find it difficult to run the operations there. With this institute, how will you try to make sure that local empowerment is enforced and that as many Africans as possible can participate in this scheme?
So that's a very interesting question, and the reason it's interesting is that when I first made contact with one of the senior professors in Burkina Faso, in my first meeting on Zoom, it became very apparent that she thought of us very much as you've just mentioned, as in, yes, these people are coming in, they're going to set something up, but history really shows us that that doesn't work. I think what we're going to do differently here is the ongoing support that we're going to provide as an international faculty. I think that's very important. We've already made some excellent connections there. There's a very senior professor there called Professor Diallo, whom we engage with. We invited him over to the UK. We had a number of meetings with him, and I also invited him to my institute in Birmingham. And he spent some time with us in our clinics, in our operating theatres, and he also spent some time at the university discussing research collaborations as well. So what we're hoping to do is to develop a long-term link with the Masroor Institute through education, clinical care and teaching, so that this really becomes a world-class institute supported by international experts. And by doing that, I think the long-term future, inshallah, will be very good for, in terms of patient care, education and research, which are really that sort of triumvirate is extremely important whenever you develop an institute.
Mir Waqar Sahib, serving humanity is nothing new to Jamaat Ahmadiyya, and you must have witnessed this firsthand, having lived in Africa yourself. Mashallah, you've been helping in terms of the implementation of the Masroor Eye Institute. Can you tell us a little bit more in terms of any guidance that Hazur has given in this regard, and anything that we can learn from the schemes such as Nusrat Jahan that the Masroor Eye Institute can take forward?
Bismillah ar-Rahman ar-Rahim. As Sir Ansarullah said, that I think this is the first time any auxiliary in the world has given this blessed opportunity to run a hospital. And technically, I think it's easy to construct a building, but running the hospital, I think especially if you want to do the administration remotely, and running it remotely is quite a difficult and big task. But I'm sure, and I think Hazur must have seen the ability in Majlis Ansarullah to run remotely this hospital. So by the grace of Allah, I would say the scheme of Nusrat Jahan, Majlis Nusrat Jahan, is mashallah working in Africa, and Hazrat Khalifatul Masih Salis Rahimullah Ta'ala, under the divine guidance and after seeing a dream, he established Majlis Nusrat Jahan. And the main objective and purpose of Majlis Nusrat Jahan was to help African nation, especially in health and education sector. And because of the history in African continent, education and health was the two main sectors. If they become independent in these two sectors, I think they can become the developed nations now. So that was the reason. And Alhamdulillah, I think more than 400 schools, secondary school or primary schools, are established under this scheme. And around 40 to I think 50, I'm not sure exact the figures, but I think more than 40 hospitals are, by the grace of Allah, are operational in different African countries. So this is the first time Majlis Ansarullah any auxiliary is doing this, because I think that was the tradition was established in Jamaat, that Hazur wants to present you something, and we are making a very nice building, or just fulfill our duty at once and then just leave that. Now that we give Hazur that hospital, we build that hospital. But it is not the purpose. The challenge is to how we can run that hospital. And because by the grace of Allah, it's not that this is first time we are, as I said, Majlis Nusrat Jahan, the department Majlis Nusrat Jahan is overseeing remotely all schools and hospitals in Africa. But the main reason is not to just oversee, it's basically to give them the African people, give them the ability and skill to run their own projects. And I think in this project, as Dr. Imran Sahib, he's our director, medical director, he, I think, engaged with lots of African doctors there, and at top level, and which is also, I think, helping us now. And also, I think we have found some Dr. Ansarullah, is trying to find out some administrator. So I think these two main areas. If we work on that, then inshallah ta'ala, the running is going to be, I think, quite successful. But as I said, because we are going to, this is the first project and we don't have that experience, Majlis Ansarullah. So it's going to be challenging, but inshallah ta'ala with Hazur's prayers, and as Sir Ansarullah said, Hazur said, Allah fadl kare and naam ki laaj rakhna, so then inshallah I think these two words inshallah will help us. And I think we also, Ukasha Saab is also our main project leader in this regard. So in this project, so what we are trying to establish is, the processes and controls, effective processes and controls, inshallah ta'ala. If we establish them, then hopefully and I think Hazur's wish to make it the best institute of West Africa, inshallah ta'ala, it will be fulfilled. No?
Miyasab spoke about equipment. We've seen a shiny lobby, we've seen a wonderful facade. Will the equipment match? And tell us a little bit more in terms of your sourcing the equipment, your procuring process, and what can patients expect there?
So the procurement process actually started probably July last year. It's taken us quite a long time under the watchful eye of Sadr Saab. We, myself and Okasha, spent a number of meetings going through various pieces of equipment with various companies. So we went through due process. We made sure the equipment was to the highest standard. So a lot of the equipment, we made sure that it was similar to what we use in the UK at our institutions here as well. Because clearly, if I'm going to be going out there to operate, I want to make sure that I can use the equipment. And equally, there's other surgeons who go out who are used to the quality of the equipment that we use in the Western world. So it's quite important. But also, the other thing that we did was that we ensured that we took a consensus from the other doctors as well. So it wasn't just myself, but I asked a number of colleagues as well who have been assisting me in this regard. And we also, the other important thing was the equipment had to be serviceable in Africa. So this is the other issue, is that the professors there have said that often these hospitals become equipment graveyards. So the other issue was making sure that there is maintenance available, making sure that there is aftercare available for all this equipment, because a lot of these pieces of kit are technically very, very complicated. And so that was another element of the project, was to make sure that all of that follow-up care was available for the equipment as well. In terms of the equipment has now been purchased. It's on its way there, and inshallah will be delivered over the next couple of months. And then the aim is to make sure that all the staffing is in place to be able to be trained on the equipment. We're hoping for sometime in November. But that's kind of a summary of how we got the equipment. Now, in terms of what it will provide for patients, from the patient perspective, we hope it will provide them the best possible care and the best possible outcomes. Because the other thing, of course, is that there is very little work on outcomes in these countries, because patients go in, have treatment. The other aspect is record keeping. There's very poor record keeping. So another aspect of equipment is on the IT side. We're working with some IT professionals in the Jamaat as well to procure, hopefully, probably one of West Africa's first electronic patient record system that we can implement there, and we can use that then to collect high quality data on patients, which will inform future planning of clinical care and also audit and research as well. So that's the way we're trying to ensure that everything is established.
So this with such a wonderful facility and expensive equipment, how will patients be cared for? Will they be paying for their care? What's the system that you have in place?
So as I said, essentially the system in place is that we hope that the hospital will become self-sustaining in due course. But initially, we would need to fund the institute And the funding, all funding up till now has been provided through Charity Walk for Peace, which is the charity platform of Majlis Ansarullah UK, and the funds are raised every year through that. People donate eye operations, so the plan is the hospital will get paid for regardless, but they would have a fund where people would be donating money, and then some care would be subsidized, some will be completely free, and some will be charged depending upon the need of the people. But to make the hospital sustainable, the hospital will get paid regardless from which fund the money is coming from. And one of the reasons, as I said, it's just a thought. I don't know, the wisdom Mazuri Akhtar Sayyidullah Ta'ala bin Aziz has in his mind of giving this responsibility to an auxiliary organization to run it. I remember back in 2019, start of 2019, I humbly went to him in a mulaqat, and I thought that it would take at that time another 18 months or so for everything to be complete. The plan was to start the institute last year. Because of COVID, things have been delayed. So I wanted him to tell us who we are going to hand it over to. And I, in my own mind, because we are all foolish and think that we know things, so I said, Hazur, approximately 18 months more, so can you please tell us, the responsibility was given to build, to Majlis Ansarullah, who should we start handing over so they can start working together to have a smooth transition into operations. And Hazur just looked up and said, "Ye Majlis Ansarullah ka project tha aur rahega." And I was absolutely flabbergasted, and in my that state, I again said, "Hazur, ye zeli tanzimon ka kaam nahi hai, hamare paas expertise nahi." So he was signing letters. He stopped. He looked up again and repeated the sentence. And I realized my folly at that time, and I apologized to him, and I requested him for prayers that may Allah enable Majlis Ansarullah and its member to live up to the expectations that he has placed on us.
Dr. Sab, for us living in the West, we have most facilities at hand. And for us to empathize with those patients who will be coming to this facility, it's very difficult. Can you give the audience and those watching on YouTube an insight into the type of conditions that will be treated and how much of an impact eyesight can make to the opportunities to that individual and to his whole household once he has or she has had treatment at this institute?
Well, I mean, I can give you an example from my own practice in Birmingham. Birmingham, much like London, is a cosmopolitan city. We've had hundreds of thousands of migrants over the years, and where I work, there is a very large Afro-Caribbean population. So I'm already seeing the kinds of disease that presents in Africa, and we have patients from West Africa, East Africa, all over. And typically, these patients present with very advanced eye disease. And the reasons for those are multifaceted, but include education. So generally, people are not aware of eye conditions and how serious they can be. The other problem is that usually these patients are aware of a relative or a friend who may have gone blind from eye surgery. Because we have to remember that the quality of care provided in these countries is not of the highest standard. So there is a fear factor as well, that often patients will refuse to undergo eye surgery. And I see that in my practice in Birmingham as well. And so the impact it has when we do these surgeries, and the commonest cause of reversible blindness worldwide is cataract. And often people will be walking around totally blind, and I mean, with absolutely no vision. So imagine, for any of us, if you want to imagine what that feels like, you just have to close your eyes and imagine trying to carry out daily tasks with your eyes closed completely and having absolutely no light coming in at all. And the impact that has on a patient is absolutely huge, and we see that all the time in our practices in Birmingham and London and wherever else where people work, where there is a lot of social deprivation. And so if you imagine that the responsibilities that adult patients in Africa will have, they will be looking after their wives, their children as well. And so often that single individual who is blind is the breadwinner for the family as well. And so by restoring the eyesight of one individual, you are actually helping a whole family regain their dignity and regain, their resource, in terms of often, feeding and things like that as well, because they have to go out and earn the money for their family. So I think there's no question the impact of losing your sight is absolutely massive.
So, Sab, you've been to Burkina Faso, you've seen the people who are anticipating and waiting for this to start, for the actual patients to come through. How is this project being received on the ground?
The project has been received brilliantly. I think I would like to thank Amisa Burkina Faso and Abdurrahman Diallo Saab, who is an engineer by profession, that they have assisted us immensely with supervision and getting us linked in with the local people there so that we are able to serve. There is a Nusrat Jahan hospital in Ouagadougou, Burkina Faso, a Jamaat hospital, a small Jamaat hospital, where they did not have any eye facility. So to start, we donated some equipment to them so they could start doing operations and get an external local doctor to come and perform those operations, the cataract operations. And the question you were asking, Dr. Saab, I have personally seen the impact. I've seen women who had not seen their child since birth because they were blind. And if you restore the sight of such a parent and they're able to see the child, or you're able to restore the sight of a child who is for the first time able to see their parents, it is immense. People are anxiously waiting with the links by Mia Saab's team that he has cobbled together, a brilliant team. I must thank them all. He found Dr. Imran, he found Ahmadu Kasha. We have ordered £500,000 worth of equipment, which is now going to be delivered. And the links that they have been able to build with the university and the professors and the ophthalmologists on the ground. I have visited their local hospitals as well. So those links, those people want to do research. They want to learn. They haven't got the equipment. They haven't got the skills. So they are anxiously awaiting completion of this. And we hope that in first week of December, when they have a West African Ophthalmology Conference, we would try hosting part of that there. And the plan is doctors from US and UK and other parts of the world, MD doctors, ophthalmologists, not doctors, would be going there, inshallah.
Mia Saab, there are Ahmadi doctors working as we speak in many different parts of the world. And what sets us apart from other communities who are serving mankind is the zeal and the passion and the prayers that they put forward with respect to their patients. How can we as Ahmadis and the future of this institute continue to implement this? And how has the Nusrat Jahan scheme already given us a precedent for such love and devotion showed towards the patients who attend such institutions?
I think if we listen to Huzur's Jalsa speeches, on the second day speeches, we can see lots of the incidents of acceptance of prayers and lots of blessings which the Ahmadi doctors, even they don't have those facilities or those resources which doctors have especially in Western countries. But I think there was a divine support with them. No? But Ahmadi doctors, as you said, they're first and foremost, I think they are depending on Allah's support and acceptance of prayers there, and then writing to Hazrat Khalifatul Masih. These are the main factors. But the Burkina Faso Institute, I think the model is those who are Ahmadis, inshallah ta'ala, they will definitely start with their work with prayers, and they'll depend, in Allah's support. But those who are not, I would say the behavior and the character of Ahmadis and how they treat their patients will definitely impact others who are not, those who are Christian, those who are atheists, or those who don't believe in Allah. So the point is that the objective is to serve humanity, and Ahmadi doctors, they have their direct and living relationship with God. So whenever they are in some difficulty or whatever they say, they will start their work with prayers. But I think we can't enforce this to others, but definitely when they see that some doctors are behaving like this, and they're asking help from divine or from God. Definitely. So I was just thinking while sitting here that by the grace of Allah, the Masroor Eye Institute is going to remove the eye issues, and they will provide they remove their not only the physical blindness, they're going to treat it, but alhamdulillah, inshallah ta'ala, we are hoping that spiritual blindness will be also treated with this institute, inshallah ta'ala.
So there's many people who will be watching and listening now, and they may want to get involved. What are the remaining needs for this project, and how can we as individuals get involved into this project?
I think the best way to get involved, first of all, is to remember all those who are working in prayers, so that we are able to fulfill the expectations placed on us by Hazur Sayyidullah Ta'ala bin Aziz. The second is the financial support. We are requesting people to set up standing orders, if they can, of small amounts of money, because we would need to fund this institute in the beginning. Anything, when you start a project, it does take a couple of years, 2 to 3 years roughly, to become self-sustaining. So we would need to fund, and that would continue to. People can go on charitywalkforpeace.org. There's a web page, and they can donate the money, which many of us and many of my brothers already have. People can also donate time to go, and waqf if they wish to go and serve there. It's a French-speaking country, so that's one of the issues, that you need to be able to speak French. We need nurses, ophthalmology nurses, we need pharmacists, we need opticians, we need doctors. So back in 2017, myself and Dr. Khalid Taslim Saab from Rabwa, the eye specialist, were there. So we were able to influence one of the final year medical students at that time, who was just graduating, to change course from another specialty which they wanted to do, to shift over to ophthalmology. So we'll continue to work with Waqf medical students who are there, so that they follow this line and continue in the longer term, 5 years, 10 years down the line, when they become consultants, they're trained. So they take the mental forward. As Miasab mentioned, it's the beginning 2-3 years, which is more difficult. We would have to employ local doctors, most likely, not most likely, almost certainly non-MD doctors initially to start with, and employ them to get it off the ground. And then with due course, our own MD doctors will continue to take it over.
Jazakallah Sadr Saab. I think we're coming towards the end of this segment, so thank you, gentlemen. Jazakallah Sadr Saab, Mia Waqas Sahib, and Dr. Imran Masood Sahib. And thank you to all of you who are here, and those of you who are watching us on YouTube. Our hope and prayer is that this institute will benefit those people who are on the ground, the patients. It will be a huge source of blessings, inshallah, for the people who have been active in its implementation, its future running, and its funding. And I hope and pray that, inshallah, we'll all be able to benefit from the blessings of this blessed scheme. Jazakumullah.
Salamu alaikum ya jama'a. Salamu alaikum. Salamu, salamu, salamu. Salamu alaikum ya jama'a. Jama'a. Salamu alaikum ya jama'a. Assalamu alaikum. Salamu, salamu, salamu. Allahu Akbar. Salamu alaikum ya jama'a. Salamu alaikum ya jama'a. Assalamu alaikum. Salamu, salamu, salamu. Salamu alaikum ya jama'a. Salamu alaikum ya jama'a. Assalamu alaikum. Asunje, asunje, asunje. Asunje alkamunina. Asunje alkamunina. Onyamena asunje